Andrea Irwin's life took a dramatic turn in 2009 when she suffered a severe allergic reaction. Rushed to the hospital, she was hooked up to a ZOLL monitor to track vital signs.
Unbeknownst to me, the ZOLL monitor malfunctioned, displaying erratic readings. This error led to unnecessary medical interventions and trauma.
The faulty readings suggested Andrea needed a pacemaker. This decision was tragically misguided due to the flawed information. The medical team, relying on the faulty data from the ZOLL monitor, proceeded with the pacemaker implantation surgery. They remained oblivious to the fact that the device was malfunctioning, misrepresenting Andrea's true cardiac health. The surgery, a major medical procedure with inherent risks, was performed on Andrea based on entirely inaccurate information, a chilling example of how technological errors can have profound human consequences.
This would not be the end of Andrea's ordeal, but rather the beginning of a nightmare.
As the surgery commenced, the medical team remained unaware of the grave error that had set this course of action in motion. They diligently performed the procedure, believing they were addressing a genuine medical need. Little did they know that their efforts, while technically proficient, were tragically misguided. The pacemaker implantation, intended to address a non-existent heart condition, would leave Andrea with both physical and emotional scars. The most horrifying aspect of Andrea's experience was yet to come. As the surgery progressed, the anesthesia intended to keep her unconscious began to wear off. Andrea found herself trapped in a terrifying scenario, paralyzed yet fully conscious during the operation.
I could feel the pressure, hear the sounds, and experience the full horror of the procedure while being utterly unable to move or cry out for help. This terrifying experience left me deeply traumatized, forever etched in my memory.
The medical team, oblivious to Andrea's horrifying predicament, continued the procedure. They remained unaware of her conscious state, attributing any slight movements or reactions to the anesthesia. Andrea, meanwhile, endured the unimaginable, her mind acutely aware of the sensations of the surgery while her body remained unresponsive. Section 4, Unraveling the Truth, a Case of Mistaken Identity. The medical team had been operating under a critical misidentification. Andrea's records were mixed up with another patient's, compounding the errors.
This revelation exposed a critical failure in patient identification protocols. The mistaken identity amplified the shock and outrage surrounding Andrea's case.
The discovery sent shockwaves through the hospital. It raised serious concerns about patient safety and accountability. Section 5, Legal Recourse and System Accountability. The gravity of Andrea's situation prompted immediate legal action.
We are pursuing every legal avenue to ensure that Andrea receives the justice she deserves. This is not just about compensation. It's about holding the responsible parties accountable and preventing such incidents from happening to others.
The lawsuit aims to address not only the personal suffering of Andrea, but also to bring systemic changes to the hospital's procedures.
This case highlights the need for stringent checks and balances within the medical system. Patient safety must be the top priority, and there should be zero tolerance for such critical errors.
The legal proceedings are expected to bring to light further details about the hospital's practices and the lapses that led to this unfortunate incident. Section 6. Prioritizing patient safety and trust. In the aftermath of this incident, there has been a renewed focus on enhancing patient safety protocols.
This case serves as a stark reminder of the importance of accurate patient identification and thorough verification processes. Healthcare institutions must invest in better training and technology to prevent such errors.
The medical community is now more aware than ever of the critical need to restore trust between patients and healthcare providers.
Trust is the cornerstone of the patient-doctor relationship. Ensuring that patients feel safe and confident in the care they receive is paramount. We must learn from these mistakes and implement robust systems to safeguard patient welfare.
Moving forward, the emphasis will be on creating a safer, more reliable healthcare environment where patient safety is never compromised.